Hi friends, in this video I would like to discuss about the Ottawa rule of ankle and knee joint. Actually, Ottawa rule is generated to avoid unnecessary imaging in acute injuries of knee joint and ankle joints. Coming to Ottawa rule of knee, it is actually indicated in acute knee injuries. If any one of these is positive, then radiological investigation should be advised, and if it's negative, we can avoid radiological investigation in that particular condition so that we can avoid unnecessary imaging and reduce the cost for investigations. Coming to Ottawa rule of it includes age above 55 years and isolated tenderness over patella and isolated tenderness over head of fibula. Whenever we are eliciting the tenderness, you should be definite that at that particular point you should check only at the patella. And if there is patellar fracture, please note that if there is tenderness over patella is positive, then ask the patient to do the active SLR also, and then you should take radiological investigation. And the second thing is, whenever there is head of fibula injury, there is a chance of avulsion fracture due to the pull of fibular collateral ligament or lateral collateral ligament of knee joints, which causes injury to peroneal nerve, and there is a chance of foot drop. So that particular injury should not be overlooked, and definitely if needed you should go for radiological investigation. And the next point is inability to flex the knee joint up to 90 degree and then unable to bear weight by the affected limb immediately after the injury and at the emergency department for 4 steps. First, you should ask the patient if weight bearing is possible or not. Second thing, ask the patient whether it was possible to walk immediately after the injury for 4 steps, and then ask the patient to walk at the time of clinical examination. And if it's not possible due to pain, then radiological investigation is advisable. This is the Ottawa rule of knee joint. Please note, isolated tenderness over the patella and head of fibula. In both these conditions, X-ray or radiological investigation should be definitely done. Coming to Ottawa rule of ankle and foot, whenever there is isolated tenderness at the distal end of fibula, that is distal 6 centimeter at the lateral malleolus and distal 6 centimeter at the distal tibia, that is medial malleolus, and if the patient is not able to bear weight for 4 steps immediately after the injury and in the emergency department, then definitely we should advise ankle joint radiological investigation. And whenever there is pain at the midfoot and whenever there is isolated tenderness over the base of 5th metatarsal and also at the navicular bone, in both these conditions, X-ray investigation should be advisable. And the third point in that condition is the patient is not able to bear weight for 4 steps immediately after the injury and at the emergency department. In that condition, foot radiological investigation should be advisable. Here you can see medial malleolus and lateral malleolus tenderness. Then ankle joint X-ray is to be taken, and whenever there is isolated tenderness at the base of 5th metatarsal and navicular bone, then foot X-ray should be advisable. Hope you understood the video of Ottawa rules of ankle and knee to avoid unnecessary imaging. Thank you.